Hello everyone, and thank you so much for subscribing to my YouTube channel. It's yet another beautiful day that allows us to do yet another series of conversations. In the last 2 months, I was doing a series on sexual dysfunctions, and today we are going to talk about sexually transmitted infections. What's a sexually transmitted infection? This is an infection, or rather a disease, that you get through sexual contact with an infected person. So your sexual encounter could be vaginally, could be anally, or could be orally. All that exposes you to a possible sexually transmitted infection. And also, besides the sexual contact, also where you have skin to skin genital contact. Genital refers to the skin around your reproductive regions. And so today I want to start with one which we call gonorrhea. We've heard about it. Growing up as young children, would be warned against unplanned for and early sexual abuse because of the risk of diseases such as gonorrhea. It is a sexually transmitted infection. It is transmitted by a bacteria called Neisseria gonorrhea. It affects both men and women. When you get this disease, or when the gonorrhea organism gets to invade your body, then it causes symptoms and destruction at the place of entry. And for women, it tends to affect areas around the vagina, around the cervix, basically a reproductive system. And if untreated, the infection can actually ascend upwards to even reach your fallopian tubes as a woman, put you at risk of many other things. In men, majorly it will affect the urethra and can also complicate with other symptoms, other presentations affecting the penis. Now, let's start with women. What are some of the symptoms? What are some of the things which will point to a possible gonorrhea infection? Number one is a purulent vaginal discharge. The second thing is vaginal discomfort, pain. The third thing is pain when urinating, what we refer to as dysuria, majorly. And other presentations could also be when you get an ascending infection where it is not treated, so it affects other parts of your reproductive system as a woman. And you could end up with infection of your tubes, what we refer to as salpingitis. You could end up with a pelvic inflammatory disease that will present with a lot of pelvic pain around this region, which could put you at risk of infertility and can also put you at risk of ectopic pregnancy as a woman. In men, they'll also tend to get a very purulent penile discharge, what looks like pus coming from your penis. They also get pain. They also, besides that, they also get pain when urinating because it tends to affect the urethra, and there could be other complications affecting other organs in your male reproductive organs, affecting your epididymis, and you end up with what you refer to as epididymitis, affecting your testes, and you end up with what you refer to as orchitis, or you get both of them and you end up with what we refer to as epididymo-orchitis. Such patients tend to present with a lot of pain, scrotal swelling. It's not an experience that any of us would want to go through, I believe. And then now, besides these symptoms that are localized to your reproductive system, could also complicate with other things in your body, could give you fever, could cause a generalized infection, what we refer to as septicemia, could actually disseminate to your joints and you end up with arthritis. So you get your joints swell and they become very painful. Could also affect your heart. You end up with what we refer to as endocarditis. And besides that, is especially for women, when you get this infection when you're pregnant, there's a risk of abortion, there's a risk of low birth weight babies, and there's also a risk of giving birth to a child who gets the infection affecting the eyes of the child, and you get a newborn baby with very swollen eyes discharging pus. This could actually put your baby at risk of blindness. Now, that is the much I can talk about gonorrhea. The thing is, we have treatment for the same. We have antibiotics, which are given, and they actually play a key role towards the cure and the management of that disease. But most importantly, as an individual, is number one, abstinence. If you haven't reached that age where you can participate in any sexual escapades, yeah? And then the second thing is, if you are a sexually active person, and then the most important thing is faithfulness to one partner, both on the side of the man and on the side of the lady. Faithfulness to one partner. That won't cost you much. It's going to prevent you and protect you from a lot. So if you have some of the symptoms that I've talked about, don't be afraid of going to seek care, because doctors are there to help you. And that is all from me, guys. Remember to subscribe to this channel if you have not done so. And in the next video, I'll be talking about syphilis. All the best and have yourself a beautiful evening.